My name is Bipasha and I am a medical student. So first, let's know you. What's your name?
Bhattacharjee.
Okay. What's your age?
50 years old.
Fine. So what do you do? Your work?
A retired army person.
Okay. So today we will be performing the musculoskeletal examination. In this examination, it would consist of me checking your various joints of the wrist, arms, your shoulders and the knees. So would that be fine with you?
Okay, I like it.
Okay. So for this examination, you have to just remove your upper clothing. It's okay?
Okay.
Okay, fine. Then let's begin.
Okay.
Inspection. Inspect the patient for the following. First, head and neck posture, symmetry of shoulders, scars, deformities, and the alignment of shoulders. Palpation. Palpate the patient for the following: tenderness, swelling and bulges, skeletal malformations, deformities, etc.
Just lift your hand like this. Okay, now just follow my instructions.
Okay.
You will be performing some movements of your hand.
Okay.
Okay?
Okay.
So first, just put your hand forward. Take it upward on the ceiling. Okay, relax. Now, take your hand and flex it back. Extend it back. Okay, relax. Now, put your hand on your side and take it up. Okay, fine. Now next, what to do? You put your hand on the back of your, like on the back. Put it. Okay, okay, that's fine. Relax. Now, you put your hand like this. Stretch this somewhat, and then this, and then go up. Now, we will perform it again. Two. Again. Relax. Now, you take your hand forward and this way. From here, this way. Then go forward. Again. Okay, relax.
Crossover test. The crossover adduction test is performed by the motion of forward flexion to 90 degree with horizontal adduction of the arm across the chest. Reproducible pain over the joint suggests AC joint involvement. This is the picture of the crossover test shown here.
Just take your hand like this. Okay. Then do this. Again. Okay. Thank you.
Apply scratch test. The apply scratch test is another useful maneuver to assess shoulder range of motion. In this test, abduction and external rotation are measured by having the patient reach behind the head and touch the superior aspect of the opposite scapula. Here shown is the picture of the apply scratch test.
Now, what you do, put your one hand at the back first. Okay. Now put your other hand and put it, just join it with that. Okay, okay. Relax. You can put it back.
Near impingement. The near impingement test is a test designed to reproduce symptoms of rotator cuff impingement through flexing the shoulder and pressure application. Symptoms should be reproduced if there is a problem with the supraspinatus or biceps brachii.
Does it pain?
No.
Okay. Relax.
Empty can test. The empty can test is a clinical test used to test the integrity of the supraspinatus tendon. In this test, the patient is tested at 90-degree elevation in the scapula plane and full internal rotation. Empty can. The patient resists downward pressure exerted by the examiner at patient's elbow or wrist. This picture here shows the empty can test being performed.
Give me your hands. Now I'll put pressure on your hands and you will try to put away your hands. Both.
Okay.
You have to resist my pressure, okay? Start. Okay, that's fine. Relax.
Drop arm test. The drop arm test is designed to determine a patient's ability to sustain humeral joint motion through eccentric contraction as the arm is taken through the full motion of abduction to adduction. It will determine if the patient has an underlying rotator cuff dysfunction.
Now I'll just put it here. Then you just slowly drop it down, okay?
Okay.
I'll remove my hand and tell me if it pains. Does it pain?
No pain.
Okay.
Palpation. While performing the exam, palpate the following. First, joints for tenderness or pain. Second, underlying bony structures. Third, muscles on the hand, the hyperthenar and the thenar muscles specifically. And the fourth is check for any fractures or swelling at any point. Hand grip strength. Hand grip strength is a measure of muscular strength or the maximum force or tension generated by one's forearm muscles.
Now you just hold my hands and hold it tightly so I could assess the grip of your hands, okay?
Okay.
Okay, that's fine.
Finkelstein test. Finkelstein's test is a test used to diagnose decurvance tenosynovitis in people who have wrist pain. Classical descriptions of the Finkelstein's test are when the examiner gasps or grasps the thumb and ulnar deviates the hand sharply. If sharp pain occurs along the distal radius, decurvance tenosynovitis is likely.
Give me a hand. Now fold it. Does it pain when I do the like this? It's paining?
No.
Okay, fine. Thank you.
Tunnel test. Tunnel sign, also Hoffman tunnel sign, is a way to detect irritated nerves. It is performed by lightly tapping or percussing over the nerve to elicit a sensation of tingling or pins and needles in the distribution of the nerve.
Give me a hand. I'll put pressure here. You just have to say if it pains or not.
Okay.
Does it pain?
No.
Okay. Thank you.
Thumb abduction. In this test, the thumb is abducted by holding the other fingers in place by the examiner. This test checks the carpal metacarpal joint.
Please give me a hand. Yeah. Now, I'll be putting pressure here, okay? And you have to resist it. You just get your finger like a thumbs up. But I would put pressure here so to resist my pressure.
Okay.
Fine? Okay. Do it. Okay. You have to put both your hands in this position.
Okay.
Okay? Try. Does it pain while you do?
No.
Okay, fine. Relax.
Inspection and palpation. While performing the knee exam, firstly inspect and palpate the following. First, the knee joint. Second, the patella and epicondyles. Third, check for any tenderness, malformations, and bone fractures, if any.
Okay. Now we will be examining your knee.
Okay.
Bulge sign. Gently press just medial of the patella, then move the hand in an ascending motion. Then press firmly on the lateral aspect of the knee. Commonly, no fluid will be appreciated. A medial aspect that bulges out after lateral pressure, positive bulge sign, is consistent with a moderate amount of fluid. Ballottement test for patella. Ballottement is a medical sign which indicates increased fluid in the suprapatellar pouch over the patella at the knee joint. To test ballottement, the examiner would apply downward pressure towards the foot with one hand while pushing the patella backwards against the femur with one finger of the opposite hand. Then lightly tap on the patella with finger. McMurray test. McMurray's test is performed with the patient lying down and the examiner bends the knee while rotating it. The click is felt over the meniscus tear as the knee is brought from full flexion to go degrees of flexion. If this is painful, then there is a tear. Valgus stress test. The valgus stress test, also known as the medial stress test, is useful to assess the integrity of the medial collateral ligament MCL of the knee. The examiner places one hand at the outside of the knee, acting as a pivot point, while the other hand is placed at the foot. The middle joint line is palpated, while the examiner simultaneously applies an abducting force at the foot and a valgus force through the knee joint. This could be performed at two various types. One is of for 0 degrees and another is for 30 degrees. The picture depicts here the valgus stress test. Stress test. The patient's leg should be relaxed for this test. The examiner should passively bend the affected leg to about 30 degrees of flexion. This could be also 0 degrees, for some examiners prefer it for 0 degrees. While palpating the lateral joint line, the examiner should apply a varus force to the patient's knee. A positive test occurs when pain or excessive gapping occurs. Anterior drawer sign. The drawer test is used in the initial clinical assessment of suspected rupture of the cruciate ligaments in the knee. The patient should be supine. The examiner positions himself by sitting on the examination table in front of the involved knee and grasping the tibia just below the front line of the knee. The thumbs are placed along the joint line on either side of the patellar tendon. The tibia is then drawn forward anteriorly. Posterior drawer sign. The patient is supine and the knee to be tested is flexed to approximately 90 degrees. The examiner then sits on the toes of the tested extremity to help stabilize it. The examiner grasps the proximal lower leg approximately at the tibial plateau or joint line with the thumbs placed on the tibial tuberosity. Then the examiner attempts to translate the lower leg posteriorly. The test is considered positive if there is a lack of end feel or excessive posterior translation. Lachman test. The knee is flexed at 15 degrees with the patient supine. The examiner should place one hand behind the tibia and the other grasping the patient's thigh. It is important that the examiner's thumb be on the tibial tuberosity. The tibia is pulled forward to assess the amount of anterior motion of the tibia in comparison to the femur. An intact ACL should prevent forward translation movement, while on an ACL deficient knee will demonstrate increased forward translation without a decisive or a soft or mushy endpoint indicative of a positive test. My findings for today's musculoskeletal examination are: first, there was a full range of motion in all joints with no problems or pain found. Second, the hands with no degenerative changes of Heberden's nodes in the distal interphalangeal joints. The proximal interphalangeal joints are also normal. All the wrists maneuvers were normal. Then, coming to the knee examination, the knee looked fine and properly normal with no malformations or deformities. All the maneuvers performed on the knee were normal with no pain or any abnormal fluids present in the knees. So, all in all, this examination was a normal examination. Thank you.